on horrendously cold nights, on days when the rain has been relentless, or when the sun is beating down and the heat is unbearable. There is an animal.
Dogs can be infected with ehrlichiosis through a bite of an infected tick. The main tick that can transmit the disease to a dog is the brown dog tick. The brown dog tick is the main carrier of ehrlichiosis. Another species of ticks that can transmit the disease is ixodes. This bacteria can also spread to humans, primarily through the bite of an infected tick. People with ehrlichiosis will often have many symptoms. These symptoms include fever, chills, headaches, muscle aches, and sometimes upset stomach. Signs of ehrlichiosis for dogs can be divided into 3 stages. Stage 1, acute, which is a relatively brief period of symptoms and can be resolved within a few days, also known as the early disease stage. Stage 2, subclinical. In this stage, now the dog may be infected, but there are no outward signs that can be seen. This stage is also known as the no outward stage. Stage 3, which is chronic. Chronic is more severe and now is an absolute infection, known as the long-standing infection stage. Dogs are usually seen in the acute phase. Clinical signs appear 1 to 3 weeks after exposure. When they begin to have symptoms, they may have joint pain, respiratory distress, swollen lymph nodes, weight loss, bleeding, and fever. This stage can last from 2 to 4 weeks. Many dogs can overcome the infection on their own when they are in this stage. It is possible and common for the patient to pass the acute phase without the owner even knowing. This leads to the subclinical stage. Here, an organism is present but is not causing any tremendous signs of disease. This phase is often considered the worst phase because since there are no clinical signs that the animal is infected with this, it goes undetected. A way that we can see if the dog is infected may only be after a blood sample is drawn. There we may be able to see the dog is showing bleeding from a puncture site. Dogs that are infected subclinically have a possibility to eliminate the organisms or unfortunately process to the next stage, which is called clinical ehrlichiosis. Here, their immune system is not able to eliminate the organism, which now leads to the dog having many problems. They may get anemia, eye problems, swollen limbs, or laggarthy. They also will have a reduction of red blood cell counts as well as white blood cell counts. Diagnosing ehrlichiosis. The immune system usually takes around 2 to 3 weeks to respond to the presence of an organism and develop antibodies to fight against the disease. For this reason, it may be difficult to diagnose the dog when they are in early stages of infection. In the early stages, the test may come up negative. Detection of antibodies as well as the symptoms that the disease will cause the dog are the best ways to know if the dog is infected with ehrlichiosis. Confirmation of this disease may require using an antibody test such as ELISA. Treating the patient. Ehrlichiosis responds well with antibiotics. Improvement in symptoms is very quick, but several weeks of treatment is usually needed for best results and full recovery. Unfortunately, dogs that made it to the chronic stage and are now experiencing major health problems such as anemia or bleeding problems may require a blood transfusion. Reinfection is possible because immunity to Ehrlichia bacteria is not long-lasting.
The scientific name for ehrlichiosis is you.